I'm just going to demonstrate just quickly some outcome assessment measures for using in veterinary practice, so that in your own vet practice you can be assured that you are improving movement and comfort for your patients. The first one we like to do for all of our patients, whether they're old dogs or young dogs, is the thigh girth assessment. Now, people don't particularly like thigh girth, but it's a great measure to see whether we're progressing in building muscle, and it's also a great measure to see whether we've done the surgery and the dogs are now walking on their front legs rather than their back legs. So the ones that we tend to do, good boy, Logan, good boy. This way so we can see a bit better. That's it. If it's a hind leg problem, obviously we'll measure the thigh. There is a standard protocol where you measure from the base of the femur to the top of the greater trochanter. So you're feeling the points. Then you measure 1/3 up, and from that point you measure the thigh girth. Now, I tend to do this as a standing exercise because dogs don't generally like to lie down in vet practice. I feel for the patella, put the tape measure around just above the patella. Make sure it stays horizontal. And then take your reading from there. The most important thing you need to mention as well is that if there is a section on the measure that's not, you need to allow for that as well. It's not a standard measure, but if you use that measure every single time, then it becomes your standard, and so that's what you compare it. So we'll do both thighs. I will also take a chest measurement. Which will indicate whether the dog has increased bulk at the front or decreased bulk at the front, or it stays the same. If you get increase in the measure of the thigh girth and no increase in the chest measurement, that means the dog is not overloading the front. Good boy. Now, the other one that we like to measure is the joint range of motion. That one's quite tricky to measure because we do need to have them lying down. In the veterinary practice, you can do it sedated, but in our practice, we don't tend to sedate our patients. So if Logan's going to be a really good boy and lie on the floor, what we're trying to achieve is measurement at the stifle. Logan. So we're feeling for the greater trochanter up here and the tarsus here. You need to make sure that you've got your pivot point in the middle of the angle where the dog's joint swings from, not on an actual bony point. Good boy. Good boy. Good boy. So from the neutral position, secure the measure, top and bottom. Gently extend. Good boy. And then for flexion. Good boy. So make sure you secure top and bottom. Make sure that the pivot point of your goniometer is in the middle of the stifle joint. So the other one we do commonly is hip. This time we're going along the pelvis. using the greater trochanter as a pivot point. This is a good thing to practice when dogs are sedated, but you'll definitely get different readings when they're sedated to when they are just plain relaxed or absolutely not relaxed at all. Good boy. Good boy. So again, making sure that we're secured on our points. So these are some of the things that we use in the rehabilitation practice to measure our outcomes and make sure that our patients are progressing. It's something that's worthwhile doing pre-surgery, so when you know the dog is going to go to a surgery but isn't actually at the surgery for the surgery on that day. So when they're first assessed, it's worth doing, and then it's worth doing once they're coming back for their 2-week checkup, and if they come back again following that time, it's good to do range of motion, checking that, making sure that they're heading in the right direction.